Honored guests, faculty, students, families, and friends, welcome to the 7th Annual School of Nursing White Coat Ceremony. My name is Dr. Kate DeLuca, and I am the Associate Dean for Student Affairs in the School of Nursing. Today's White Coat Ceremony signifies the students' entrance into the nursing profession, particularly the clinical portion of the profession, where the nursing ethics and professional behavior are emphasized. Students will also take the Florence Nightingale Pledge to commemorate this milestone in their careers and pledge their commitment to provide compassionate and high-quality care. While we know that this looks a little different this year than most, we are honored that you are all able to attend tonight and celebrate this wonderful accomplishment. I would ask the students to think back to your freshman seminar course last fall. If you remember, I asked you to think about what kind of nurse you wanted to be. We also had you write an essay that identified the qualities and characteristics that made a great nurse. Some of the most common answers were to be an advocate for my patients, to be empathetic, to be comforting, confident, and understanding of my patients. One of you answered, to know that every day I'm doing all I can to make my patients feel comfortable and cared for. We talked about how to set goals to develop these qualities and characteristics in addition to your clinical nursing skills, not just for after graduation and throughout your career, but for when you enter clinical in your sophomore year. I mentioned that 12 months from then, you would be entering clinical and having your first interactions with patients as a nursing student. I also joked that it goes by fast, and here we are today, celebrating your entry into the clinical phase of your nursing program. As you read the words of the Nightingale Pledge aloud with Dr. Snyder, I ask you to please reflect on their meaning, the qualities and characteristics that you feel make a great nurse, and how you will carry these words out as a nursing student in clinical and eventually as a practicing nurse. We are so excited to celebrate with you today and cannot wait to see the nurse that you become. At this time, I would like to introduce our Dean, Dr. Mary Ellen Glasgow, who will offer remarks and introduce the keynote speaker. Dr. Glasgow.
Good evening, Sister Mary, students, parents, family, faculty, and guests. It is a pleasure to be with you this evening for the White Coat Ceremony. The COVID-19 pandemic has really highlighted the role of nurses and the critical role that they play in our society. They are the only human connection for patients sometimes at this critical time. And tonight, you will don a white coat. That white coat is your pledge and a reminder that you are now entering the clinical education phase of the program. And what that should remind you of is that you need to practice with conscience, compassion, and dignity. You are taking a pledge tonight to be ethical in your nursing practice, to maintain confidentiality of your patient's information, to be compassionate, and to advocate vigorously for your patients. It also means that you need to be prepared when you enter the clinical site, that you research your patient's diagnosis, their medications, their treatments, so that you can be safe and know about their care. It means that you will maintain all their patient information in your confidence, and that you will treat every single patient with dignity. At Duquesne, we care about ethics, and we also think about every patient in terms of their mind, their heart, their spirit, and their body. And tonight, you will don a white coat, and it will change you. And you will now be in the clinical phase of your program, protecting patients in your care, and it is vitally important that you live up to these ideals. I wish you the best of luck as you enter this phase. We know that you are prepared, we know that you are up for the challenge, and we know that you will live up to these ideals. Good luck. It is my pleasure tonight to introduce Cherise Skinner as the White Coat Ceremony speaker. Cherise is a graduate from Duquesne's BSM program in 2014, and she also obtained a Master of Science in Nursing degree in informatics from the University of Maryland in 2018. and she intends to pursue her PhD in nursing at the University of Maryland as well. Charisse is presently the clinical informatics specialist at Greater Baltimore Medical Center, and she is responsible for working with clinical areas to optimize and drive efficiencies in clinical care and their optimum use of the electronic health record. On weekends, Charisse presently works at the University of Maryland Medical Center caring for patients in the ICU who have COVID during the pandemic. And she previously was a charge nurse and a registered nurse at the Neurological Critical Care Unit at the University of Maryland. She is the recipient of many, many scholarships while she was at Duquesne. Chi Eta Phi sorority, the William Henry Fitch Scholarship, and the Vera I. Hines Global Women's Leadership Scholarship recipient. But on a personal note, I'm really pleased to have Charisse here this evening because Charisse was the first student I met when I became the dean at Duquesne, and I found her to be intelligent, ambitious, enthusiastic, and compassionate, and I'm very proud of the person and the nurse that she has become, and it is with great pleasure that I welcome Charisse Skinner.
Hello, everyone. My name is Charisse Skinner. I am a 2014 BSN graduate. I also received my master's in nursing informatics from the University of Maryland. Currently, I work as a clinical informatics specialist. Some of you may be asking what that is, and I'll explain that to you as I get further in. I also still work as a bedside nurse in an ICU staffing pool at University of Maryland Medical Center. So during Maryland surge, I picked up more time there to help out with the COVID pandemic. I first want to start to congratulate you all for being here today. I was in your shoes 10 years ago, which doesn't feel like that long ago. You are very lucky to be here in this position that you are today. I cannot tell you how many times that I have either interviewed for a job or met another nurse, and I've been asked, where did I do my undergrad? And I say Duquesne University, and all you hear is about how great that program is. They always talk about maybe other nurses they've either worked with or they had worked for them that have been really great employees, and there's nothing short of excellence that comes from people that I meet that know Duquesne nurses. Being a Duquesne nurse is going to be very challenging. The program is hard, I will be honest about that. But the good thing is that you will come out stronger, smarter, and very confident nurses. I personally knew that I wanted to be a nurse when I was in 9th grade. My father had gotten into an accident and was in the hospital. It was very hard for me to really see him in that vulnerable state. But the one thing that I do remember is the nurse coming into the room, and my mother and I just had so many questions, didn't know what was going on, and I was so worried, didn't want to leave him at the bedside. But the one thing that made me feel comfortable is how I just felt that nurse gave my mother and I that sense of confidence that he was going to be okay, he was going to come home. And I knew for myself that I wanted to be that someday for somebody else's family. So I knew that I wanted to be a nurse. My first day of nursing school, my mind was already, made up what I wanted to do. I knew I was going to do these 4 years. I'm going to become an ICU nurse, do my 2 years in ICU, and then just go on and become a nurse anesthetist. Some of you sitting here today might already have a plan for yourselves. During my time at Duquesne, I tried to seize every single opportunity to really enrich my experience at Duquesne and my education, to prepare myself and make myself the best nurse possible. I constantly thought, what else can I do to become the best nurse? I specifically remember when Dean Glasgow came my junior year. She was talking to our class, and I don't really remember the context, but just talking about us as students doing extracurricular stuff outside of the program. And I remember her saying, only do 2 things, not 22 things. And at the time, I remember thinking to myself, she doesn't know me yet, but I can do 22 things. At that time, I restarted the Chi Eta Phi chapter at Duquesne and was president of that. I was also a nurse patient tech at UPMC Mercy next door to Duquesne. So I would work night shifts, get off, go to class, study, maybe pick up a evening shift during that time, I did a lot. Also during that time, that opportunity being a patient tech at UPMC Mercy also allowed me to get a nurse internship at University of Pittsburgh Medical Center Presbyterian Hospital. And that's where I really began my experience in the ICU. So I actually ended up having 2 jobs. And what was really good about it is that as I got into my really core classes like pathophysiology, I would learn about things in class and be able to go to work or go to my nurse internship and ask those nurses about certain things and really actually physically see those patients that I'm learning about in class and really, get to understand what I'm truly learning. So it's just such a great experience for me. The best thing that I can say that I've experienced that I had at Duquesne is I was able to study abroad at a nursing program in Costa Rica. So I did a summer program down there, which was really nice. And I studied medical Spanish as well as tropical medicine. I had also, during that time, which was really nice too, is that on the weekends when we didn't have class, we got to go to resorts. By February, my senior year, I already had a job lined up, ready to go to start in July. So I only had to focus on studying for my boards. I had found a nurse residency program at Georgetown University Hospital. And at the time, as I was telling my classmates and some of my professors about it, that it wasn't a big thing yet of nurse residency programs, and no one really knew what that was. But now, what you guys are going to see by the time you graduate in 4 years, now it's the standard across most hospital systems of nurse residency programs to be able to support nurses. As soon as I was a new grad, about 6 months in, I was already looking for the next thing to do. I wanted to go back to school and continue on with my education, but I didn't know for what just yet. My original plan as a freshman, which was do my 2 years in the ICU and then become a nurse anesthetist, was out the window at that point. As a new grad in the nurse residency program, they really focused on, getting involved in council, really looking at how you can make improvements in the hospital. And that's how I got involved into informatics. So long story short, I got involved in informatics at Georgetown. I returned to University of Maryland's nursing informatics program. I got my master's degree in that. Nursing informatics is the specialty that integrates science with multiple information and analytical sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. So kind of what I do now, I work as a clinical informatics specialist at Greater Baltimore Medical Center. What you'll also learn is that there are 2 major systems that are used for electronic documentation, one being CERN, another being EPIC. So the hospital I work at now, we use EPIC. So some of the things I really work on is, quality improvement, performance improvement, and how we can make the electronic health record work for nursing. So we, myself, I want my nurses to work smarter, not harder. So I really focus on creating and optimizing things in our electronic health record to help with even patient safety as well as useful tools at the bedside. So one of those things that you can think of is what's really important that we look at is patient satisfaction. How we're taking care of our patients developing any type of infection while in a hospital or wounds or things like that. And we were seeing a lot of that at our hospital. So one of the things that I did is that we came up with a plan of doing a purposeful rounding. And what that was is that we would go into advocated nurses to go in the patient's room and really address all their needs at one time. And we used the electronic health record. What to do with that is that it actually gave a trigger system where they can look at the patients that they had actively rounded on. And then I was able to pull data. And when we have patients that did maybe have developed some type of wound or infection or anything like that, the data really correlated and showed that, patients that were consistently rounded on every hour or 2 hours had a better outcome. We also look at things about patient safety, as you're hanging medications, setting in rules and building in alerts that will alert nurses so it prevents them from making mistakes. So that's just a little bit of what I do with clinical informatics. When I tell everyone I would not be in this position, today without my experience at Duquesne. The faculty was amazing, and you are going to be amazed how much you learn from them. every shift I work, when I do work bedside, there's not a shift that goes by where I can't say that, so it's something that somebody at Duquesne taught me. Just a few weeks ago, I had worked in multi-trauma ICU, and I specifically remember, I'm not sure what the situation was, but I remember what came to my mind was, Professor Rosanna Henry taught me this in simulation one time, and that's what really made me think of it. And as you go on, even when 4 years from now you graduate, you start your career, you're going to find even very small things, someone, whether it's a clinical skill or some type of knowledge, someone at Duquesne had taught you that, and that's going to carry on throughout your career. I could go on forever about how amazing the program is. Honestly, if I could go back for 4 years and do it again, I would. But I hope all of you truly enjoy your time at Duquesne and get so much out of this experience. If you ever want to get in contact with me or have questions about things that I do with my career, you can surely reach out to me. Someone will find me, and I'll be happy. And I'm happy to always connect with undergraduates because, there's so many opportunities for you while you're in school, after school, and so on and so forth. So I thank you for listening to my speech here today, and I hope you guys enjoy your time at Duquesne.
Thank you, Charisse. In a few minutes, students, we will ask wherever they are watching this from to stand, put on their white coats, and recite the Florence Nightingale Pledge on the screen with Dr. Snyder, Chair of the Undergraduate Programs. Please stand up and put your white coat on. Dr. Snyder will now lead you in the recitation of the Nightingale Pledge.
The modern Nightingale Pledge. I pledge myself here before my God and in the presence of this assembly to practice my profession with integrity. I will endeavor to maintain and elevate the standard of nursing, both as a science and as an art. I wholeheartedly recognize the importance of high standards of care and of personal accountability. I devote myself to the healing, protection, and welfare of those committed to my care. I accept a duty to work for the improvement of health in the communities in which I live and work. I will hold in confidence all personal matters committed to my keeping and will respect the privacy of medical information. I will act with compassion in ethical matters. I will not knowingly administer or consume any harmful substance. I commit to interdisciplinary collaboration and lifelong learning. I fully acknowledge the seriousness of the responsibility that I accept in my calling and the significance of this pledge that I take today.
Congratulations to all of the students. A complete list of students participating in the white coat will run on the screen following the blessing of the students. Sister Mary Myers will now offer the blessing of the students and the benediction.
Good evening, and let us pray. Good and gracious God, we come before you tonight to ask your blessing on these young women and men who are beginning their journey into the profession of nursing. They have received their white coats, symbolizing the responsibility they will now have toward their patients. Grant them wisdom to know the information that will help them care for all. Grant them compassion to attend not just to the physical, but to the mind, heart, and spirits of the patients entrusted to them. We ask that you keep them safe as they enter a healthcare system struggling to manage a global pandemic. May they always remember, as they put on these white coats, that they are taking on the mantle of being a Duquesne nurse and live out the mission to be proficient in the art and science of nursing and to provide ethical, holistic, culturally competent, and population-based collaborative care to all. We ask this blessing this night and entrust these students and their patients to your care, as we ask all things in Jesus' name, amen.
Thank you for joining us, and please stay tuned to see the names of all of the students. Thank you.